Hey guys, Dr. Matt Palladino here. So many of you know, at the end of every month, last weekend, we've been doing in-person workshops. They've been amazing. We had 15 or 16 people this past Saturday. And I've had a lot of people who are just unable to make the talks or have forgotten or something has popped up. So what I decided to do is after I give the talk, I'm going to then basically give it again and make a video about it and post it. That way everybody who is unable to attend can see the video and get the information. So this past month, the topic was gut health, and our talk was Gut Health 101. It's going to be a two-part series. There's just so much stuff, and we were unable to get into everything. So this is the first part. Hope you enjoy it.
So, Healthy You, this month topic is Gut Health 101. So, why does gut health even matter? Well, the health of our gut really affects pretty much every aspect of our health. Everything from our immune system. You could say there's 70 to 80% of our immune system is based in our gut, which is a lot. So when our gut is dysfunctional, it also affects our immune system, and that can lead to things like chronic illness, a lot of infections, a lot of different problems, skin health. A lot of people don't realize this, but a lot of people have different skin issues like eczema or psoriasis. A lot of times, it's actually what we call a downstream issue from a gut health issue. Unless you get into a patch of poison ivy and you get poison ivy, a poison ivy rash or contact dermatitis would be what that's called. The most skin issues are actually downhill issues from gut health issues. Even things like acne, for a lot of people, are downstream issues from gut issues. It may not just be one step downstream, and maybe two or even three steps downstream. But one thing that we consistently see is once you focus on gut health, a lot of times skin issues clear up as well. Mental health. There's a huge connection between the health of the brain, mental health, things like anxiety, depression, um, mood, how it relates with the health of your gut. There's all sorts of different things, and we'll be getting into that a little bit more. But mental health is definitely a big part of it. A lot of your body's serotonin is made in the gut, so a huge connection between mental health and gut health. Sleep. So I think that ties pretty close with mental health. But like I said, a lot of serotonin is produced, neurotransmitters are produced in the gut. And so when our gut health is off, it can throw off our hormones, it can throw off our neurotransmitters, and that can affect sleep. And when you're not sleeping, I mean, that's a really big deal. That can affect all sorts of areas of your life. High stress, that can lower immune system response, can cause all sorts of problems if you're not getting adequate amounts of sleep. Obviously, digestion is a big one. Um, if your if your gut health is poor, you're not going to be digesting food, which can lead to things like diarrhea, constipation, bloating, excess gas, acid reflux. I mean, those are all pretty standard things. General GI pain. Another one that's not listed on here, which is another one, it would be like hormone imbalances can a lot of times be related back to gut health. So gut health is really important, and but can be very confusing too. So what we're doing today is talking a lot about gut health, obviously, but more in the realms of digestion. And then the next talk or workshop we give is going to be giving a little bit more into, let's say, like chronic disease and gut health. So the gut is our second brain. So one of the things we talk about with gut health is the gut-brain axis. So like we talked about before, there's all these different things that our gut affects and that go into the health of our gut and the health of our body. And so there's a huge connection between what's called the vagus nerve and our GI system. So you can see, let's see right here, the brain, there's a vagus nerve, it comes here, and it's one of the main stimulators that stimulates digestion. The vagus nerve is very important. Actually, like if when someone falls and have a bad accident and they break their neck, the reason that they're able to still, I guess, survive is because the vagus nerve doesn't actually exit out through the spine like the spinal cord does. And so that's actually a pretty interesting mechanism. But this nerve goes directly from the brain. It wanders down. Actually, the term vagus nerve, vagus means wonder. So it wanders down and it innervates and controls all sorts of different autonomic functions, and the gut is a big one. But you can see down here when there's a lot of inflammation in the gut, it can lead to all sorts of different problems, leading to neurodegeneration. So it can lead to chronic issues like Parkinson's, Alzheimer's, maybe even MS down the line. And there's all sorts of things that can affect our digestion. One of the things here is genetics. Well, genetics can play a certain role, but it's only a small part. But you have all sorts of things, environmental toxins, infection, sleep quality, diet, your gut flora, which we're going to be talking about a little bit later, your mucosal immunity. So basically your gut barrier. But all these things go together, and there's a huge connection between the gut and your brain. So the three main functions of the digestive tract are to break down food into large to small particles to absorb nutrients the body needs to function, and to act as a barrier from damaging the elements from the outside world. So one important concept when we're talking about GI, the GI tract, is actually the GI tract is actually the outside of the body. And so I have a picture of 3 bagels here. And the reason I have the picture of the 3 bagels is because this was actually how it was explained to me when I was an undergrad, learning about the GI tract. So if you look at these bagels, you can see that, I guess, this right here, you can see my mouse, the cursor of my mouse. I mean, this is the whole of the bagel. So this is still technically the outside of the bagel, right? So if we take a bagel and then we would stretch it long, have the world's longest bagel, the inside, that hole, it would still technically be the outside. It would basically create a tube where like the bagel inside the skin of the bagel would be the interior. And that's essentially what our GI tract is. Starting from our mouth, it's a tube and it goes down and has different stops. You start with your mouth, goes down to your esophagus, into your stomach, small intestine, large intestine, and then out the anus. So you basically have a whole, I guess, canal system where the food comes in one end and goes out the other end. But even though it's going through our body, it's still technically the outside of the body. And so one of the main functions of the GI tract is to control what gets in the body. And the body is a very sophisticated way of controlling that, moving food through, breaking it down. But it's just a really important concept. It's how we keep a lot of bacteria out. If you eat some food that has salmonella in it, the reason that you start puking and get diarrhea is because your body is trying to get those bacteria out of the body so it doesn't get absorbed inside of the body where it can cause some real damage. All right, so we're going to talk about digesting food in terms of food breakdown. So how does food, something like this cheeseburger, turn into our nutrients that we need? So the main nutrients are proteins and amino acids. So proteins and amino acids, there's essentially 20 amino acids that make up the proteins that we need as humans. Fats, simple carbohydrates and sugar, and then vitamins and minerals. So these are kind of the basic 4 areas that food gets broken down into that our body absorbs and then can use. So just here's a little graphic for you, just so you know kind of what turns into what, because there's a lot of terms that get thrown around. But essentially, the carbohydrates get broken down into sugars, and there's different types of sugars. Proteins get broken down into amino acids, and then oil and fats, they get broken down into fatty acids. One thing that can be confusing is the difference between fat and oils, and there's sometimes this misconception that an oil is healthy and a fat is bad. That is definitely not true. Really, the only main difference between a fat and an oil is liquid at room temperature, where a fat is solid at room temperature. And the way that a lot of the digestion happens is through what are called enzymes. We'll be talking a little bit more about this, but all these things in the middle, these are different types of enzymes that basically break stuff down. So food breakdown, what is an enzyme? An enzyme is a protein that does something. It usually adds or takes something away from another protein or molecule. So one of the things I'm going to do is kind of explain some buzzwords that you hear if you read an article or maybe listen to a podcast, and like you hear the term enzyme all the time, but what is it? An enzyme is a functional protein. So here's my little example. On the left hand, we see a little red vehicle, okay, and then on the right we see another red vehicle, but it's a tow truck. So it's a vehicle that has a specific purpose that moves something else. And so all these enzymes, they float around in our GI tract, and when they bump up against something, they kind of have almost like a lock and key where it attaches, and then it'll usually add something or take something away. A lot of times in digestion, specifically, it's separating things. It's breaking down bigger compounds or molecules into smaller parts. So that's what an enzyme is, and your body uses all sorts of enzymes all throughout the body to break things down or to combine things. So enzymes, you have to have enzymes, but it's a very big word that you hear, and I really want you to understand what it is and how important it is to digestion. Another really important concept with dealing with digestion and helping patients get better with gut issues is digestion happens from north to south. If upstream issues are not resolved, then downstream issues cannot be resolved. And so upstream or north is essentially the mouth, and the furthest south would be when it comes out the other end. So, one thing, a good example of this is, a lot of people are taking probiotics. Everything's take probiotics, take probiotics. Well, in terms of the GI tract, probiotics are pretty far south. They're pretty far downstream. So if you're having a lot of issues and taking probiotics help, that's good. But generally that means that there are issues going on upstream or further north of your large intestines that need to be addressed, that are causing the bacteria in your gut to be imbalanced, or what we call dysbiosis. And we'll be getting a lot more into that in part two, but that's a really important thing. Digestive issues have to be taken care of from north to south in order for there to be true correction. If not, then you're just going to be putting a band-aid on a lot of digestive issues. Okay, so food breakdown. So like I said, north to south, digestion begins in the mouth, or I guess technically right before it gets in the mouth. So even smelling food, hearing food sizzle, seeing it will actually activate parts of our brain and get the digestive enzymes moving. Okay, so you have salivary glands that release saliva into your mouth when you start to eat. That saliva contains different enzymes that are made to break down different parts of the food. Obviously, a big part of what the mouth and the teeth do is they grind the food into small parts, and that's really important. As you're chewing, the enzymes break down carbohydrates, fats, and we also have enzymes in our mouth that help break down the wall of certain type of bacteria, so the bacteria isn't going down, so we're not swallowing bacteria if it happens to be on our food. So our body has all sorts of mechanisms in place to help kill off bacteria as it goes through the digestive process. One big thing that could be causing digestive issues alone is if food is not chewed properly. It can be difficult for it to be broken down and absorbed downstream. This can lead to inflammation and irritation of the GI tract. So essentially, if food particles are too big, once they hit certain parts of the GI tract, they can be a real irritant to the body, and then that can cause things like diarrhea, or can cause things like bloating. So even just chewing food properly is really, really important, something you need to focus on. Side note, a diet high in sugar can feed bacteria in the mouth and lead to dental problems, bad breath, digestive issues, and even heart issues. So, we have bacteria everywhere on our body. We have it on our skin, we have it in our GI tract, we have it in our mouth. One of the things that see happen, especially if you're someone that has a lot of cavities, it probably means you're eating too much sugar, too many refined carbohydrates, and that's feeding a certain type of bacteria. And when it feeds those bacteria basically create a toxic waste product, and that can affect the health of our mouth, the health of our teeth, can lead to, like I said, bad breath. Every once in a while I'll get a patient in, they might have a really swollen knee or elbow. They woke up with it and it's red and inflamed, and it's like, hey, that joint's infected. That you need to seek immediate medical attention. And sometimes bacteria gets into our system and floats around, and where it can lodge in different places like our joint. Like I said, even there's studies that show that proper oral hygiene can actually improve heart health because we're killing off bad bacteria and the bad byproducts from the bacteria. So, if you're someone that deals with, you feel like you have bad breath all the time, instead of reaching for gum or mint, maybe it's time to reevaluate your diet and see what's actually going on in there. The stomach, after the mouth, so we swallow the food, it goes down the esophagus, and it ends up in the stomach. So each part of the digestive tract kind of breaks down different parts of food. The stomach's main concern is with breaking down proteins, using acid and enzymes. So when we talk about proteins here in a second, I have a visual, but you might hear a term called the denaturing. And essentially what that means is that denaturing is when proteins are kind of unraveled and then broken down into their amino acids. So our body likes to absorb amino acids, which are the building blocks of protein. So in the stomach, you see pepsin and gastric lipase. Gastric lipase actually helps break down fat. The pepsin helps break down protein. But that's what the main goal of the stomach essentially is to break down protein. Okay, so talk a little bit more about protein digestion. So in this visual on the left, you can see that amino acids, they're like the individual beads on a necklace. Okay, so there's 20 different beads that we use to make proteins that our body needs. When you have a long string of amino acids in many different sequences, they kind of tangle up on each other. They actually look a lot like the spiral phone cords that you used to see back when we all had home phones that would get tangled up into a mess. That coiled knot of mess is what protein looks like. And what the acid does, and what the enzymes do, is actually it unravels them, and it allows the acid unravels it and allows the enzymes to work and then break off the individual beads. Another way that you can denature proteins or unravel them is actually with heat. And a perfect example of this is when you're cooking eggs. If you crack an egg in a skillet, the egg white, it'll be clear, and as it cooks, it turns white. Well, that's you literally seeing a protein being broken down, being denatured, and that's why we're seeing that. So there's a couple ways you can break down or denature proteins: heat, with acid, or enzymes. When we cook food, we're using heat. When you digest it, you're using the acid, the acidity of the stomach, and you're using enzymes. So if someone has low stomach acid, or has low digestive enzymes, or has something inhibiting their digestive enzymes, then we're not going to be able to break down these food particles, these proteins in the stomach very well, and that can lead to a lot of irritation later on down the road. Some things that can lead to problems digesting proteins would be, one, if you're under a lot of stress. Stress really seems to affect the digestive tract. And we know this, right? Like if you are under a lot of stress, people complain a lot of times of heartburn. It's just our body has different parts of your central nervous system. Mostly we call it the sympathetic and parasympathetic. The parasympathetic is kind of what controls the digestion. The sympathetic controls more like what we call fight or flight. And so they're constantly in like a battle between each other. And if you're under high stress, your body's just not really prepared to digest food well. And when we see someone that's under a lot of stress, or maybe in a lot of pain, or in a stressful situation, or maybe even in a stressful environment like you're on a vacation, it can be difficult to digest food. Another thing that some people don't realize is there's certain plant chemicals, like tannins or maybe oxalates, that can actually inhibit enzymes acting on proteins. And so, just because like a food is a fruit or a vegetable or a nut or a berry, even though it might be good for some people, it might actually be causing you digestive issues because the tannins in it or some other plant chemical or compound in it can inhibit the normal function of our digestive tract. So that's something to look at. So if you're someone that deals a lot with GERD or acid reflux, you might want to see, what type of foods you're eating along with maybe your meal or with meat that when you actually get the reflux. So a lot of times it gets blamed on the meat itself, and that's I can understand that, because if you're eating meat and then it's not being digested well, it's not going to make you feel very well. So I might think, oh, I need to steer away from eating meat, but in reality, what you need to do is maybe the food that you're eating with the meat is blocking your body's ability to digest and break down that meat into the amino acids. So continuing down, digestion happens north to south, very important. The small intestine mainly breaks down fat and carbohydrates with a variety of different enzymes. The small intestines is where the majority of nutrients are absorbed in the body. So, stomach was mainly focused on protein. When we get more down to the small intestines, that's where a lot of our fat gets broken down. Things like different like lipases, things that break down fats, bile salts. Those all help to break down fat, emulsify fat, get it down into smaller and smaller molecules into fatty acids, where it's then absorbed through the intestinal wall, as well as amino acids are absorbed there, sugars are absorbed there. Small intestine is where mainly fat gets broken down, but also too where absorption happens. So it's really important. Food is moved through the GI tract by a process called peristalsis. So your essentially your GI tract is made up of what's called smooth muscle around it, and it's just a type of muscle, and when it contracts, it moves stuff through. One of the reasons why, sometimes you drink your morning coffee, then all of a sudden, 10 or 15 minutes later, you got to run to the toilet because stuff is moving, is because caffeine actually will speed or trigger peristalsis. It gets stuff moving through your system, and sometimes that can be a good thing. I would say if you're relying on coffee every single morning to have a bowel movement, you've got some issues going on. But one of the things that can happen too is, we talked about before, the difference between the sympathetic and parasympathetic nervous system. If you're under a lot of stress, sometimes we see peristalsis slow down, and that can lead to things like constipation, because stuff isn't the brain isn't necessarily signaling the GI tract to move stuff through the peristalsis. It started to slow down. Actually, one thing that you see in neurodegenerative disorders, one of precursor before you might see cognitive decline, before you might start to see tremors, is a lot of times people start to complain of constipation, and that's because the signaling from the brain to the gut is starting to be hindered, and you're just not getting the proper messages. So it's very common for people who have things like Alzheimer's, Parkinson's, MS to also be dealing with constipation. So food breakdown. This is a pretty cool picture. So this is a zoomed in view of the small intestines. Okay, and so you have these fingers called villi right here. The pink part would be the inside of the body, and the white part would be like the inside of the intestine. So technically the outside of the body. So what happens, and you see my little arrow cursor here, is as food particles that are now amino acids, fatty acids, and sugars come through here, they essentially, these create a lot of surface area, these fingers, and they go and they come down here. This area right here, all along the border, is one cell thick, and sometimes food passes between the cells, and then sometimes certain things pass through the cells. Different food particles, different vitamins, different minerals, different things our bodies absorb are absorbed in different ways. So, I think this is pretty cool to see a visual of it. And you have blood vessels that run up through here, and then so stuff gets absorbed, and then it gets absorbed into the bloodstream here, and then that's how those nutrients are then carried to different parts of the body. So the purpose of the large intestines then, after moving from the small intestines, is to absorb water and minerals, as well as clear waste out of the body. So by the time food gets through the small intestines, most of the absorption to the body is done. The large intestine is where a majority of the bacteria, the good bacteria or the gut flora is located. And I'm not going to get too much into that on this talk, but as stuff gets absorbed, the bacteria in your gut also acts on it, helps to break it down further. Your body also dumps waste into your large intestines to move stuff through. So it's not all entirely food. There's actually like dead red blood cells essentially get dumped into your colon, get moved through. All sorts of stuff gets moved through your colon, and that's how your body rids itself of solid waste. So one of the big things we see with digestion is what we call maldigestion, and then this occurs when the digestive glands do not release the proper digestive enzymes needed to properly break down food, or if your body is releasing the proper digestive enzymes and they're being blocked by different molecules or food compounds that might be found in different foods, specifically plants. I'm not going to get too much into this, but there are definitely a lot of chemicals in plants that we consider defense chemicals. And this is a pretty standard thing in botany, that plants, because they don't have legs, they can't really run away. They don't want to be eaten by different animals or insects, so they have chemicals in them that are specifically designed to act as defensive mechanisms. I'm not saying that all plants-based food is bad at all, but what I'm saying is sometimes certain plants can really be causing a lot of problems with people, and just because it's a vegetable, just because it's a nut, because it's a seed, because it's a bean, and you've been told it's healthy, that doesn't necessarily mean that it's healthy for you. And just like all things, it may have healthy components to it, but it also can have negative components as well that are affecting you. And so certain things you just may need to cut out. Foods that are high in tannins, foods that are high in lectins can also cause a lot of problems. Foods that are high in oxalates are another one. And in another talk, I'll get more into that, but that's just a very, very brief thing. A good example of maldigestion, or the inability to digest a certain food, and what happens is lactose intolerance. There's an enzyme called lactase, and essentially what it does is when you consume dairy, it has a sugar in it called lactose, and that sugar molecule lactose needs to get broken down in order for our body to use it. But if you don't have the right enzyme, your body doesn't produce it, or produces very little of it. That lactose is very can be inflammatory to your intestines, to your GI tract. And if you've ever met someone who's lactose intolerant and they drink milk or eat cheese, there can be some pretty significant aftermath with that, with a lot of gas, diarrhea, a lot of problems, bloating, some pain. So being lactose intolerant is a great example of maldigestion. But that's on the extreme end. A lot of times it's more like it's not as extreme, but the stuff that's not getting digested, once it gets down into the small and large intestine, is still irritating. So a lot of times people end up taking digestive enzymes in order to help properly break down food, and digestive enzymes really help. If food is not broken down properly, or if it moves through the GI tract too slow, it can cause poor nutritional absorption and or GI inflammation. So we just kind of talked about that. And chronic inflammation of the GI tract can lead to severe GI issues like Crohn's, IBD, diverticulitis, and even cancer. So chronic inflammation anywhere in the body is not good, and is generally the cause to most chronic disease processes that attack specific organs, tissues, or systems in the body. So, so basically, you don't have a perfectly healthy gut one day, and then the next day you wake up and boom, you have Crohn's. No, there's a process, and they each have their own pathophysiology, their own mechanisms of how they form. But chronic inflammation is definitely a huge factor in people developing these conditions. So what causes maldigestion? An imbalance or dysfunction of the organs and glands that release enzymes. So you have like the pituitary gland, the stomach lining, the liver, the gallbladder, the pancreas, the small intestines. These things all release different enzymes that are needed to essentially break the food down into smaller and smaller sizes so they can be absorbed. And if these glands are not functioning properly or being released, or if something that you're eating along with your food is inhibiting or blocking these enzymes, you're gonna have maldigestion. So how to deal with maldigestion? So balance the digestive system and glandular system. That's something where that's kind of like the type of treatment that I do in my office. It's more of a holistic approach, where we're balancing the body's nervous system, and when the balance in the nervous system is balanced, we're working on balancing out the sympathetic parasympathetic. I've seen a lot of people have a lot of GI issues clear up just with that, with the type of care that I give in my office. You can take digestive enzymes to aid in digestion, decrease stress, like we talked about emotional stress, physical stress. Those are all things that can inhibit. A good way to think about that is, you don't want to eat a large meal and then go try and run a marathon. Why? Because your body is not focused on digesting food. It's focused on the physical stress of running the marathon. You're not going to digest food well if you're out running immediately after you eat a large meal. Chewing food better. Just breaking food down mechanically into small bits really, really helps. Focus on liver health. Liver plays a huge part in digestion, and liver, especially like non-alcoholic fatty liver disease, is on the rise. And one of the things we see that with is a lot of stuff has high fructose corn syrup in it. That can cause a lot of problems. So really focusing on liver health, avoiding foods that are inflammatory to the small intestines. Avoid plant-based food that contain natural pesticides and defensive chemicals. So we've kind of hit on that. I've found that a lot of people who have digestive issues, they have some complexity to them. Very, very rarely do you ever find a person who has digestive issues and they do one thing and it just clears up. So I would say most people have multiple things going on that have kind of led to problems, and you got to hit it from all fronts, and you got to take care of it in the right order, like I said, north to south. So if you're having a lot of digestive issues, unfortunately, there probably is not going to be just one smoking gun that you take care of that and boom, everything goes back to being perfect. So chronic inflammation. Chronic inflammation can cause serious problems in the GI tract by damaging cells that release enzymes or that are used in absorption. So we looked at this picture on the left earlier of the healthy section of the intestine. We see these nice, healthy, big fingers, these villi. On the right, we see what happens to a damaged small section of small intestines where there's been chronic inflammation there. So you can see what's happened. Those fingers start to basically get destroyed. They start to lay down, and when that happens, we start to see less surface area for food to travel down. So remember, food gets broken down and travels down into these valleys, and they have all this surface area. Well, over here on the right, we have a lot less surface area. Less surface area means poor absorption. These cells right here, some of these cells release different types of things that are needed to aid digestion. When those cells are damaged, you're not releasing them. So you can see that one thing leads to another, but with chronic inflammation, you start to get some pretty significant breakdown of these villi, which can cause a lot of problems. So that's essentially the overview of digestion, maldigestion. One of the things I do run tests in the office. One of the main tests I do is a GI profile, and this is a sample of a report of a patient report. This is just the first page, but it's a really good test, and it tests for 5 different areas of gut health. And you can see there's maldigestion, which we just spent a lot talking about. So it lets you know, if you need digestive enzymes, if you need bile salts, if your HCl levels, your hydrochloric acid levels are off. Inflammation, do you have a lot of inflammation? Are those villi, are those fingers in your gut being destroyed because there's chronic inflammation? Dysbiosis. Didn't really get too much into dysbiosis on this talk, but essentially is all of that good bacteria that is in your gut, is it way out of balance? Do you need to be taking a probiotic? Do you need to be taking a prebiotic? Do you have what's called SIBO, small intestinal bacterial overgrowth, meaning is there too much bacteria in your small intestines, which is causing problems. Metabolic imbalance, like your short chain fatty acids, all these things, they all go hand to hand, and also to infection. Do you have a chronic infection somewhere in your GI tract that is causing issues? That could be causing ulcers, that could be causing chronic diarrhea, it could be a yeast, it could be a bacteria, there could be all sorts of things that are causing all these problems. So this is a great non-invasive test, meaning there's no blood draw necessary. It's done by a home stool sample kit that you take, and it's pretty simple, but it gives absolutely valuable information, and it's so much more comprehensive than a lot of the GI panels that I see run by like many family practitioners, even specialists. You know, a lot of times I'll have a patient, they have a lot of gut issues, and they say, well, I went to my family doctor and they sent this one and it just tests to see if they had a chronic infection. Hey, you don't have a chronic infection, and so maybe take some probiotics, and if you have some acid reflux, you know, I'm going to put you on some protein pump inhibitor because we're going to decrease the acid in your stomach. And it's like, well, you know, that's not really correcting any issues. You need that acid in your stomach to break down protein. As soon as you start to inhibit the acid in the stomach, I mean, you can potentially lead to other issues later on down the line. I mean, one of the main issues of stomach acid, other than breaking down protein, is actually it's defensive. It helps kill off bacteria. So you're actually opening yourself up then to a gut infection. So all sorts of things. So if you're having chronic gut issues and you just, I guess, haven't been able to get the answers you want, and you want to take a very, you know, very specific, evidence-based but yet holistic way of dealing with your gut issues, definitely give us a call or shoot us a message. You can come in, and I'd love to talk with you about that, and we can get you going on one of these tests and really help. But I mean, so many people suffer from digestive issues. So anything, we just need to get stuff balanced, but it has to be taken care of the right way. So hopefully you enjoyed this this workshop. The next one will kind of be part 2 on this. We're going to be talking a lot about leaky gut and dysbiosis, and another condition which is like a severe combination of the both called endotoxemia. And we're going to be getting into like how leaky gut can lead to chronic disease issues and autoimmune disorders, and all sorts of things. Getting more into some really interesting stuff. At least I think it's really interesting. And so if you can't make that one, definitely I will be putting out another video like this, so you'll still be able to watch it. Usually our workshops are the last weekend of the month, but this month I have a seminar I'm attending the last weekend of the month, so it'll be April 23rd. We'd love to have you there. Please let me know if you have any questions about the video. You can drop a comment, or you can send us a DM, or you can ask sometime when in your office. I hope you have a great day.